We're now going to demonstrate a two-step impression. It uses a putty, wash, and a spacer. This is your armamentarium for the impression. You have a small square of plastic wrap that you've cut out. You have adhesive for the tray, a timer so that you can properly gauge the set of your impression materials. We have a light body fast set wash. We have our putty. It's a VPS putty. We have it measured out for the proper size for the tray, and we have our trays, and that's the things we need to make the impression. The most common mistake in taking an impression is using an improperly sized tray. There's two things to consider when selecting a tray. One is that the tray needs to completely cover the teeth without touching the teeth or the gums, and it needs to extend behind the last tooth in the arch. So if we were to look at a tray on this model, we would see that this tray fits in every way except it does not extend behind the last tooth in the arch. So if we take another tray, you can see that this tray extends past the last tooth in the arch, and it does not touch the teeth or the gums. That's a properly sized tray. I've showed you how to fit the tray properly on a model. Now I'm going to demonstrate that on a live patient. You can see clearly that the tray extends past the last tooth in the arch on each side. You also see that it doesn't touch the gum tissue all the way around. In fitting the upper tray, you place the tray in just behind the last tooth in the arch, then you slide down, making sure that it doesn't touch the gum tissue or the teeth. As I said before, the use of tray adhesive is very important. Without the use of adhesive, you don't know if some of the material has pulled slightly loose from the tray, and you may have a small distortion in your impression. So place the adhesive on the tray and let it set for a few minutes so that the solvent can evaporate. Now let's do the lower tray, placing the tray adhesive. As I said before, tray adhesive is very important because if you don't use it, even though you have these perforations in the tray, the material may slightly pull from the tray and you have an unseen distortion. Once you place the tray adhesive on, you need to set the tray for a few minutes for the solvent to evaporate. Now we're ready to start making the impression. So we have to mix the putty. You take the putty, this is fast set putty, so you have to work fairly quickly. And you mix the putty till you get a mixture without streaks in it. You have about 30 seconds, so it's not a long time to work with the putty here. So when we get the putty mixed, or we have a nice even mixture, we make a little sausage and we place that in the tray. Then we take our spacer, place that over the material, and we just kind of make a little channel of indentions with our thumb. Then we take this to the mouth. Okay, so we take the impression tray to the mouth, place it in, get the lip out of the way, and then you have to press firmly down, making sure, there, that's perfect. When you're placing the tray, have your patient lift their tongue up so it's not under the edge of the tray. That way it doesn't get in the way when you're pressing down. After 1 minute, you can remove the tray, remove the plastic wrap from the tray. Now you do this before this material is completely set. Now we take our light body and we express that into the indentations in the tray. You don't need a lot. And we go directly back into the mouth with the tray. Press down. And we set the timer for 2 minutes. After 2 minutes, we'll remove the tray. And we get a very nice impression, as you see right here. No pulls, no bubbles, looks great. When you're doing the upper, you only need the sausage roll of the material. Make your indentations. Take the tray to the mouth, place it back all the way, and then push hard and move the lips out of the way. And you time this for 1 minute. After 1 minute, you'll remove the tray, remove your plastic spacer. This is what you see. You take your light body fast set material, place this in the tray. One nice thing about using the spacer is there's no contamination of the material because the spacer protects it. No need to wait for the putty to be completely set. And we take the tray back to the mouth, place it in, make sure we get our lips out of the way, and you time the fast set light body for 2 minutes. After 2 minutes, you remove the tray from the mouth, and this is the impression that you get. Examine it carefully, make sure you have no pulls. You don't need the whole palette, you just need down to the gingival margin. Looks great.